Let's start healing, everyone. I'm Adrienne Murchison, and welcome to episode 42 of the Let's Start Healing podcast. This is actually the start of our second year with the Let's Start Healing podcast, and little did I know a year ago, or did any of us know, that in spring of 2020, we would be in the age of coronavirus or even have any idea what that would mean. But before we get started, let me remind everyone that we have more in common than we think, and what we have in common can change the world. And the world is changing. We are in a shutdown across the world right now, and I don't think we're going to be quite the same when we return to normal, whenever that will be. I don't think we'll be quite the same. We are a world that has been used to running at a rapid pace, and we have all, at least most of us, have had to sit our behinds down and pray that this virus will come to an end, and that the people who are ill right now will recover and become whole, healed, and healthy once again. I've talked to so many people who have shared what they think the meaning of all of this is. Some people may not think that there's any meaning behind this, but a great many people that I talk to think that this means something on one level or another. Many people refer to the Bible. Many people refer to different individuals who predicted that this would happen. And of course, we do know that health professionals that worked with the federal government knew that this was going to happen, because they talked about it over the last 4 or 5 years. They talked about a pandemic of this kind. But what does it mean? I certainly have my own thoughts, and shared them in the previous episode, of how I think as a collective we created this. And perhaps one of the reasons that we created this was indeed to slow ourselves down. Maybe it was indeed to become more mindful and more understanding and compassionate of one another. All of us certainly will not be more compassionate and understanding of one another after this is over, but I definitely know that a great many of us will be. I mean, we've had so much time already to just be still and be quiet, and to look at our fears around death, our own demise, or of our loved ones. And that brings some mindfulness in itself. But that is not what this episode is about. This episode is about me wanting to give a platform to different people who are trying to make a difference during this time. One thing we know is that so many people across the U.S. are making masks. And they just want to do what they can. They want to contribute in the way that they can. And our guest today is one of those people. Her name is Nicole Smith-Hall. She already is a designer. She designs beachwear, and she designs jewelry, and a very, very talented young woman and mother. Her sister, who is also a guest today, Andrea Smith, is I call Andrea a marketing guru. She's a marketing expert, no question. And Andrea was actually featured on episode 20 of Let's Start Healing. So please go back and listen to that if you haven't already. Nikki and Andrea started the 100 Masks Project. And Nikki has created in 2 weeks more than 200 masks. And what makes her mask so unique is that they are multi-layered. There are now 4 layers in each mask. She started out making 3-layered masks, and now she's making 4-layered masks. And she's going to talk about that. I'm so looking forward to you getting to know Nikki and being inspired by her as well as Andrea. Before you meet them, I want to remind you that you can listen to all of our episodes on multiple platforms: Apple Podcasts, Spotify, iHeartRadio, and our podcast YouTube channel. Also, follow Let's Start Healing on Instagram and Facebook. Please stay safe, be well. I love you. Let's meet Nikki and Andrea. Let's start healing. Welcome, Nikki and Andrea. I'm so glad you're here.
Thank you for having me.
Absolutely.
Yes, thanks, Adrian.
Absolutely. And Nikki, your 100 Mask project is very inspiring, which is why I'm grateful that you're here doing the podcast. You started it 2 weeks ago, is that right? Or last week?
Yes. So this week would have been the full second week. Yes.
Okay.
Okay. So really, I didn't know anything about it. My sister, who watches the news and stays way more up to date, a lot more than I do, she called and told me about how nurses are needing masks and people in the medical field need masks because there's just a shortage due to COVID.
Right.
And so she was like, get to sewing. she man things for me sometimes, but no, she was like, get on the sheet and make some masks. And so I'm thinking, well, I need a mask for myself. And so I started making this prototype of a mask because a lot of people were donating just cotton, just front back cotton kind of masks. Some are made out of t-shirt kind of material.
Right.
But then I kept thinking, like, why am I just going to wear cotton? It's not going to help really anything. If it gets wet or something, it's just going to absorb into the fabric. And so I decided to go on a hunt for water resistant fabric. Right. And so I'm just walking around the fabric store and I was getting ready to give up because I just couldn't find anything. And I asked one of the people that worked there and she said, well, in the baby section, there's water resistant fabric. And I was like, oh, well, duh, I'm sure babies need water resistant things. And so I found water resistant fabric, which is used to kind of make baby bibs. Some people make diapers, reusable diapers out of it. And so that's one of the layers in the mask. And then the other layer is a water moisture wicking fabric. So it'll help keep moisture off of your face. So that's the layer that touches your face. Okay. And then in the middle, I added kind of like an extra filtration in there. There's more, it's more like a very thin liner. And then, so typically the masks are 3 layers, but they've been 4 layers now because honestly, I get bored with the same print. So I cover it with another print. So the outside layer, some of them are cotton because I might want an African print, or it just depends if I feel fancy. Yeah.
Design, a little flavor in there.
Yeah, exactly. So if I'm feeling all fancy and saucy and stuff, then I'll put a little cheetah print on it or something. Just because I get tired of the same print. But I just felt like it couldn't just be a cotton mask. If the point was if somebody sneezes and you need to keep moisture off your face, I don't want it to just absorb and sit there. Right. I needed to keep it off of my face. So I did kind of invest in a bit higher quality fabric, not saying anything against what somebody else does with cotton. I just felt like I needed more.
Right. So you've made well over 100 masks by now.
Oh my goodness, yes. Andrew, what was the last count that you had that I gave you?
You're at 188.
Oh, okay. So I know that I'm past 200 now because this morning I just put out some more.
Good.
So, yeah. Yeah.
So you said averaging like roughly 100 a week. So now the 100 Mask Project has become like 100 a week, as long as she thinks she can keep it up.
Yeah.
Well, so now who have you donated to? I know you mentioned some first responders and some home health care workers. Is that right?
Oh, yeah. So, well, the idea when Andrew told me about it, I was just going to sew, 100 and then take them to a local hospital. But I haven't even had a chance to call a local hospital because as soon as I put this little video out on my Facebook page about my attempt to make a mask, I got inboxed by so many just nurses, RNs, nurse practitioners, from around the country, a lot from Georgia, and then just around the country, firemen, first responder fields, then some that are not considered frontline workers, but people who assist elderly in the home. So, kind of the nurses, I don't want to say the forgotten ones, but the ones that aren't getting as much attention because they're not in the hospital on the front lines. Right. But those who still go and serve our elderly, I get a lot of in-home health aid nurses that need a mask because they just can't get one. nursing homes.
Mm-hmm.
Lots of nursing home nurses and CNAs that just say, hey, I need a mask. People who work at the front desk in the office that check in, they need a mask.
And so are you sending them one mask, or how many are you sending out usually?
I started off with one, but I was like, man, they need to wash it. But if they're
That's what I
washing it, they're
worry
going to need
about.
another one. Yeah.
That's what I worry about. I think about, I haven't worn a mask yet, and I'm thinking, well, that's going to get dirty. I have makeup on.
Yeah. Yeah. So I've been sending two. One is a superhero mask. It has like some kind of superhero, incredible, somebody on there. It just says, thank you for being a superhero in the health field. And then I send one that is,
awesome.
It might have a different print, like cheetah or polka dots or African print or something fancy. Yeah, something with a little sauce on it. But so typically I send two, even though I said only send one.
So you send two, and they're washable. They're easily washable.
Yes, they're washable. So I've washed mine many times. I just throw it in the washer of my laundry and then dry it normal. The directions say you should wash it on cool and dry it on low dry. But I have 3 kids and I don't have time for real instructions in laundry. So I just throw it in there. I just threw it in there and washed it, and it came out. Mine actually, my first one actually shrunk just a smidgen, not a lot. I could just tell that it was a little bit tighter, so I adjusted my pattern some to accommodate for those people like me who don't really follow laundry instructions.
Do you tie them on, or is there some kind of elastic band?
Okay, so some of them have, it just really depends on supply. Now, this is the crazy part. I never thought as a seamstress the day that the fabric stores would be running out of supplies. This is just a crazy time that we're living in, and they're actually considered essential stores. So when most places are locked down or shut down, fabric stores, local fabric stores are still open.
I didn't realize
And getting
that.
supplies from them, even ordering supplies online. So some of them it depends on the supply. So some of them are elastic behind the ears. If we're out of elastic and I can't get it, then they're tied. They're tied mask.
And how are you sending them out? You're mailing them, or what are you doing?
Yep, I ship them out. And my sister, who is so helpful, she like sends an update of COVID every day. Andrea is so funny. Well, I mean, funny, not funny, but she's like, you cannot go to the post office. And so I went and bought a postal. I know. I bought this postal scale, and I talked to my local carrier, so he's wonderful, my mail guy.
Yeah.
And so I ship, and I have an account where I can print my own shipping labels from home. And so I ship them from here. And I'm very cautious here because I keep thinking to myself, like, I don't, want anybody to get sick from, because these are homemade masks. You have to think about that.
Exactly.
So, so just being, who are you ordering from? Are they being sanitary? And so I'm constantly wiping down I'm out of Clorox wipes, and of course you can't get them. And so I just, make a spray mixture. I'm constantly wiping down my work area. I'm constantly washing my hands using hand sanitizer. I'm so paranoid. If I touch my face, it is. And I'm like, what if, I don't want to make anybody sick. And I put in the instructions, although I clean my area, still wash your mask. Because this fabric came out of fabric stores that people have been touching. And so I just put in there, I just want people to be safe,
And are the masks free? I know you're asking for donations. How does that work?
Yeah, so with the donation, that just helps cover shipping and supplies, really. And so I send you a mask, or sometimes they say, I don't want the mask, could you please send it to my mom, and then donate one to somebody in the medical field. Or sometimes people have somebody in mind in the medical field they want to donate to, and they say, hey, can you send one to me? And then I have a friend that's a nurse. Can you send it to her and just to let her know I want her to be safe and healthy?
Are you comfortable sharing what people have donated and so far, and how much that helps?
Oh, yeah. Most of the time it's in $20 increments. And then sometimes it's $20, sometimes it's $40, sometimes it's $100. I've gotten prayers in my inbox and $100 just to say, hey, this is just to cover supplies and shipping. I don't even want a mask, but I just really want our health field workers to be safe.
Yeah.
And, if you just add that prayer in there for me on a little note, I would appreciate that. And so they've just been rolling in, and even if they say they don't want a mask, I still send them one just a thank you.
Have you had repeat business?
Yeah, I do. Actually, I've had a couple people come back and say, hey, I'm gonna need one for, I'm gonna do some more donations. So you send them to whoever you want in the medical field, but I need my girlfriend and her husband to have one, and my daughter, she just got deployed, I need her to have a mask. And so I've had people come back a couple times now and order some more.
So,
do you have a lady who went to New Orleans also, or somewhere she had to be deployed and she needed one?
Oh, yeah, that just kind of melted my whole heart. I honestly sent her like 4 masks because I was like, I don't know what her laundry situation is like there.
mm-hmm.
I don't. She didn't. Apparently, nurses are being deployed now to go to our heavy hit area. So
Yeah.
one of them, I had to go to New York. The
Mm-hmm.
other one is in New Orleans. And she just said, we're being deployed. I don't even have a mask here. I don't know what to expect when I get there. Can I please have one of your masks?
Now,
I
these
was
are
like, you need to
nurses
really have
that
4. Huh?
these are nurses that are not in the military, but maybe they're having to go from, say,
Yeah,
one
they're
state
just
to
hospital
another.
nurses.
Right.
Right. Yeah. So
Mm-hmm.
they're shifting from one state to another, like you said.
Right,
Yeah.
right, right. Now that you've been doing this, you're 200 masks in, what has this meant to you personally to contribute in this way?
Oh my goodness. Well, Andrea kind of knows some of the story. Well, it actually, when she brought it to me, she knows that I like to serve anyway. I'm a server, and I
Mm-hmm.
believe that if Jesus can serve us, then we can serve our fellow people also. If He can wash the feet of His disciples, then why can't I
Right.
help somebody else? And I also believe that when you give, it always comes back.
Mm-hmm.
But my daughter has been sick. She's had some GI issues,
Mm-hmm.
and she has been since February 19th has been sick and cannot get medical treatment.
How old is she?
She's 8,
My
and
goodness.
everywhere I go, I get turned. Everywhere I call, I get turned down. They pushed her appointments out to June, and so I just sit up with her 2, 3 in the morning, just rocking her so she can get comfortable. And while I know that this is not um,
Yeah.
a super urgent thing for a mom, it's hard to watch every single night
Yeah. Is it like
your kid go through
reflux or
this.
what is she experiencing?
They can't diagnose her because the one appointment I was able to get,
Mm-hmm.
her blood work came back healthy. That's a great thing, but they don't know if it's IBS. They don't know if it's something onset by a flu she had, back in February. They're not sure, so they can't treat it. So they're kind of doing their best to treat the symptoms.
Mm-hmm.
But I hear so many stories now for the same situation I'm going through where they can't get treatment because of COVID. And so
Mm-hmm.
part of me is like, if I just keep making these masks, maybe people will be healthy and
Mm-hmm.
other people can get medical treatment. So I don't know. I guess just save the world one little mask at a time, I
Yeah.
guess.
Yeah.
Like maybe
Yeah.
my contribution kind of to help. Because I know people who had cancer surgery and they need a follow up and that got pushed out. And one of
Mm-hmm.
my good friends she needs reconstructive surgery and it was actually scheduled recently. And then of course they canceled it because it wasn't considered urgent.
Mm-hmm.
And the doctor actually told me, she said, your daughter, although she's in a lot of pain, she's no longer by definition considered urgent anymore.
Mm.
So
This is
we won't be able to
this
do.
is your
Mhm.
daughter. This is your daughter?
Yes, this is my daughter.
Goodness. So this way you feel like you're able to stay busy and contribute in some way and help the healing. And
Yeah, yes, definitely.
hmm Andrea, why was this important to you that Nikki make these masks?
Well, for one, I know she's a busybody, and if she doesn't have something to do, she's going to get in trouble. So,
Now, who's older?
I actually am.
Okay.
But we're only like 13 months apart, so
Okay.
we're like
You're like twins.
essentially the same age. She actually forgot how old she was recently. That Adrian, they totally thought that this recent birthday I had, they thought it was my big 4-0.
I saw that on social media. You had to explain.
Yeah.
It was so hilarious. I was like, did you forget how old you are? Oh my gosh. Like, so my mother forgot how old she was when we were growing up and she was in her 30s, like
Yeah.
mid-30s. And she literally looked at her driver's license to figure out how
Yeah.
old she was.
Like these kids will do it to you.
Hey, believe me, I've had to do that not that long ago.
Yes. So it was just so funny, like full circle, like, haha, you just became mom. Yeah.
Right.
But yeah, but for real, I saw the need online, and on the news and everywhere, and it's still a problem. Still, weeks later, it's still a problem with PPE.
Mm-hmm.
Nurses, frontline people, our EMS people, our people who have to stock the grocery shelves and work in the grocery stores.
Yes.
And the UPS guy, and like all these people who still are considered essential and have to get out there and be exposed in the public, none of them have what they need. And, and so there was that call put out that, people should be making homemade masks. And as you know, Adrian, it's just back and forth with all these rules on whether or not we should have masks. For a moment, there was a thing where it was like, don't get masks. Our medical people need masks. And now just recently, as we were just talking about, now the recommendation is that people should wear masks in an attempt to, keep the spread down and, protect other people from you, in case you have it and you don't know it, and so, I'm not a sewer. Like our mother sewed growing up, and she is an excellent seamstress. She did my sister's prom dress. I was too bougie for that. I was like, I don't want no homemade prom dress. But she's so good. She did my aunt's wedding dress. And so my sister got that gene for sewing. Yeah. And so when this came up, I was like, Nikki, you've got to sew this. Like, you can do this, drop everything and start making some masks. I know you can make it. And the instructions were simple. You can just Google it online. And now I'm sure it's everywhere, because seamstresses all over the U.S. are making them. Yes. So I try to get her to like scale up and hire some other seamstresses and things, and she was like, "No, I don't trust their sanitation. They're not
be dirty."
Like, yeah. She was like, they could be sick and getting people sick. So you got to respect that. But yeah, so she just picked it on up, and she's been running ever since. And so I just check in on her every now and then, like, are you still like doing it? Are you still good? Like you're not burning out on it and getting tired of it. And so far she seems okay. So as long as she's busy, that's good.
Right. And I really appreciate the mindfulness in multiple layers. I think that's very important. So I really appreciate that, Nikki.
Thank you.
I would like for both of you to share what you do, because you, Nikki, if you could tell folks about your website, and don't you design beachwear and jewelry? And
oh yeah, so by day I'm a teacher, or an educator. I'm a teaching coach, actually.
What do you teach?
Yes, I'm an educator, and so I'm an instructional lead teacher, meaning that I go into classrooms, I kind of model for teachers how to teach and things like that, and I comb through a ton of data.
For high school, middle school, elementary school?
Elementary.
Okay.
Elementary school. So this has definitely been a challenge because we're having to switch over to digital learning.
Yes.
And so I'm having to coach teachers through platforms and programs, and I even meet with parents digitally to show them how to get on and, make sure their kids can access work. And so I do that, and then of course I'm making a mask right now. But then my company, that's my baby, Charleigh Rocks. It was named after my daughter. My sister actually came up with the name. She's so good at stuff like that.
Yeah, she is. We're going to get to her.
Yeah, so she came up with the name, and then May will be 5 years. And really, it was kind of started off with a little side hustle, and then it grew and grew and just kept going. And I do design beach covers. They're called beach shikis, like a dashiki, but a beach shiki.
Yes, yes.
And so it's just this big, long flowing fabric that just looks beautiful on the beach and kind of covers everything. And when you go into like restaurants to sit down and eat, you're not, like naked. You have something on that's still beautiful but looks beachy.
Yes.
And kind of, hides your flaws too. But the jewelry, I contract a lot out, from wholesalers, and then I have a few artists that hand make some pieces for my line, hand make some earrings and hand make some bracelets for my line. And so that's part of the vision of Charleigh Rocks. Number one, to always be able to give back into my community, which is why the mask, which is one reason why I do the mask also. And then to also employ women one day. And so right now, although I'm not able to just employ women, when I support their craft. So if they're artists and they make jewelry, I typically will start buying from them. To sell on my site. So that's Charleigh Rocks in a nutshell.
And spell out Charleigh Rocks, because her name is spelled a little different.
Yes. So she was named after her granddad, of course. It's a male name. So we try to give it a little female twist. And so it's CHARLEIGH. Rocks is ROCKS, one word.
.com.
For the website, .com.
And if folks want to get in touch with you, can they email you? How should they go about that?
Oh yeah, so if you go through my website, there's a little chat feature on the bottom, or in a contact form on there, and you can use that. It comes directly to my email. And technology is so wonderful right now, really. I mean, even us doing this podcast together, just practicing social distancing,
Yeah.
being able to talk with each other. But through my email, a lot I get DM'd on my Instagram at Charleigh Rocks or my Facebook at Charleigh Rocks. And my email is Nicole, Nicole at charleighrocks.com.
Okay. And so, Andrea, you are a marketing guru as far as I'm concerned. Has this time been different for you, this space that we're in right now, and also obviously share all that you do in your marketing business?
Yeah, well, it's definitely, I think it's the whole world's been turned upside down, and all of our businesses, are affected in one way or the other, whether we're staying in business or not. Luckily, so far, knock on wood, throw some salt over your shoulder and all that. My business is okay. I thoroughly expected several clients to drop out, when this happened, and they still could, ask me next month. But so far, everyone's okay. Even, I was most worried about a client who's in the aviation space because, their main core business is the aviation industry. And so when the airports had to shut down and, Delta and everyone else, where they had to shut their doors, or shut down operations at least, I was very concerned about what might happen with them. They're my biggest client at the moment. And so far they're hanging in there, and I just talked to them because they were kind of going crazy for a minute. Like, they have 150 employees, and they were like, we might have to drop our employees. They were going kind of crazy, like, what should we do? And I just encouraged them to please, consider, like, how can you pivot in this moment? How else can you be of value? Like, think back to the other business you used to do before you got into the aviation industry, like just everything, just consider all the different ways. You have to get outside the box right now and think, how can you give value at this moment, even though things are crazy? And miraculously, they did come up with a really cool new way to handle business. So they've gone into the space of cleaning our bus systems and public transport that still has to operate for, some of our key personnel, the people who still have to get into work and they're having to use public transit. So they are going into that space, and, they're equipping up their people, and they've, quickly turned around everyone. They were literally out shopping for supplies for cleaning. So far, so good. They've managed to turn it around. So I'm very, very proud of them.
That is incredible.
So yeah, I know.
Are they, do they normally clean airplanes, or what were they doing in the aviation business?
So they did a lot in the aviation business. They staffed lounges. They're mainly in the staffing space. So they staffed lounges. They just got a really big deal before all this happened with Clear Channel, which is, and I'm sure you're familiar with Clear Channel. They're a big outdoor advertising space, but they also do radio, TV, all of that advertising. And so for all the airport advertising, Clear Channel just got, they just opened up a big airport division for their business. And so this company was staffing the people who were the boots on the ground, checking the airport advertising, making sure the right spots were running when they needed to, making sure the displays were not damaged or dirty or, literally looks good. So their people were doing stuff like that, and concession stand stuff, so janitorial stuff, that's everything these people did. So it was just awesome that they were able to turn it around and save these jobs at this moment. I'm sure, maybe there's not every job that got saved, but to be able to keep these people working and not having to get in the unemployment line like 3 million plus other Americans, that was awesome.
Right. Yeah, that is amazing that they were able to, like you said, pivot. And I want to comment on how you give back just in normal times. You have different initiatives that you'll do in social media, and you'll for example, your spring challenge or your fall challenge, where you'll get people on board and help them to enhance their social media. And you do that just out of the goodness of your heart. Would you talk a little bit about that?
Yeah. Oh, yeah. That's just a fun project. like, I guess I'm with my sister in that way, that I need things to do with myself. So. Not like we don't have enough going on, but it was a fun thing to do, to bring about these little challenges. So they're online challenges, and so far they're 8-day Instagram challenges to help people figure out what to post in their business. As business owners or personal branders, we get so busy. We have so much going on. It can be hard to think about what to post and when, and, to keep it kind of regular. And so these little challenges I came up with are just a way to remind people, and kind of give them an excuse, quote unquote, to post more during a period of time, and get them back in that habit of posting.
Yeah.
So we always do like a hello, introduce you post, and then it's always some other cool post. This time for our spring challenge, we did a countdown to spring, and our fall one is a countdown to the first day of fall. And this spring one, we did some post ideas like, take us behind the scenes with what you do, and, show us something or tell us something that we wouldn't normally see. People love stuff like that. They love connecting with the real you and, how you really operate. Yeah. So it's fun. It's fun for me. And I hear great comments every time we do it. This one was kicking off as COVID was picking up.
Yes.
And so I was really like, ooh, maybe I shouldn't do it. Who knows? It could have gone either way. But some people encouraged me, and they said, this is good and it's positive, and, we need something positive. Mm-hmm. So I just went with it, and we just did it. We'll see how that goes in the future. But it's been great so far. I really love all the great comments, and, people get into it. They help each other and follow each other. So it's really good.
Well, I really appreciate both of you and what you're doing. And going back to the mask, it's just so many people want to give back. A lot of people, whether they're even children, are making masks now, to do their little part. And, so I think there's going to be a lot of good that comes out of this dire situation that we're in. We're going to be different.
I definitely agree. I think that people are realizing that this isn't a black and white issue. It's not a race issue. It's not a gender issue. It's not a sexuality issue. That this can affect all of us.
Exactly.
And I think that's something that's kind of bringing people together.
Right. Well, before we close, Andrea, how can people get in touch with you?
Yeah, so very easily. It's the ADS Agency, THEADS, like ads, like advertising, agency. .co is the website, and you can also find us on social media anywhere with that same handle, the ADS Agency, on Facebook, Instagram, Twitter, LinkedIn, YouTube, and then we'll save TikTok for another day. But but yeah, you can find us at the ADS Agency anywhere. So thank you, Adrian.
Oh, thank you, ladies. Thank you so much.
Thank you. Yes.
Thank you for joining us. Remember, you can listen to all of our podcasts on Apple Podcasts, Spotify, iHeartRadio, and our podcast YouTube channel. Also, please send me that email. Let me know what you think about our podcast at letstarthealingpodcast@gmail.com. Let's start healing.